It is an established fact that good nutrition is fundamental for a healthy and productive nation and its people. Despite this understanding, nutrition has been under-prioritized for a very long time. The COVID-19 crisis, which has started from early 2020, has made dent in health and nutritional outcomes that the India was aiming to achieve, unwinding the hard-earned developmental gains made over the past decades. The fear of COVID-19 infection, coupled with disruption in the health services and reduced purchasing power and supply chain disruption, has been impacting the overall nutrition aspects of children and women especially. We know that essential health services has been disrupted because of the closure of schools, village health and nutrition days and Anganwadis. There is decline in the overall uptake of services, especially the antenatal care services, institutional deliveries, weighing of children and the nutritional counseling to pregnant women and caregivers. NFHS 5 data, which is available for 22 states, very clearly shows that in spite of improvement in institutional deliveries, only 50% of newborn babies has been breastfed within the first 1 hour of birth. There are international guidelines, especially the baby-friendly initiatives, for which several of the health facilities and professionals being accredited to. There is a clear failure to enact this recommendation, which is considered to be the best practice. The first hour of newborn should be considered as the golden hour to making sure that the essential newborn care services, including breastfeeding, is provided to the babies. It is important to practice the inclusion of birth companion for the women in the labor room, so that it promote breastfeeding, as well as it is also to promote the zero separation policy, which mandate the baby to be put between the breasts immediately after the birth. Other thing which we need to look into is that separation of low birth weight babies and the preterm babies, because of the special care that they required into the newborn intensive care unit. While we focus on survival of these babies, it is also limiting the chances of breastfeeding. So therefore, the evidences suggest that the current newborn intensive care unit need to be converted into maternal newborn intensive care unit, so that breastfeeding can be promoted and kangaroo mother care and skin to skin care can be continued to practice in these settings. Breastfeeding doesn't end in the labor room or in the health facility. It needs to be continued in the home, so that exclusive breastfeeding in the first 6 months can be practiced. This required an enabling environment and the support from the community and the family to encourage breastfeeding, which includes counseling and involvement of caregivers and fathers into the care of the babies, adequate maternity leaves, especially for the informal sector workers, and regulating the inappropriate marketing of breastfeeding formulas and the substitute industry are essential for promoting breastfeeding. What we need is the strengthening of system, which is essential for improving the overall health and nutrition services in the country. Adequate investment in the health systems, ensuring facilities and supplies, mentoring and capacity building of staff, and supportive supervision and monitoring of practices. That is what we require to improve the overall services and the essential newborn care, including breastfeeding in our facilities. What we also know that several of the healthcare workers, when they have learned these skills, they are unable to practice it because there is no monitoring or they have not been adequately supported. Children are the future of the country, and we must invest adequately to ensure that firm ground has been there for their growth and development. We know that nutrition is fundamental, and nutrition is the foundation, and nutrition cannot wait.